I can see vacuuming around our guests. A little weird, huh? Well, with Thanksgiving being tomorrow, it's a day when many of us will load up, of course, on the turkey and the stuffing and the mashed potatoes and bread with a side of heartburn, right? Joining us now to talk about some ways to prevent that is our own Chief Health Editor, Dr. Partha Nandi. Good to have you with us on this day before Thanksgiving. All right, certain foods I know are more likely to cause heartburn, correct?
Right. If you don't burn down your kitchen, both of you, then we can enjoy some of the foods. You know, we talk about fatty foods, spicy foods, fried foods. Specifically for Thanksgiving, you know, avoid the cranberry sauce. If you're going to have mashed potatoes, it's great, but less gravy and butter. And then the alcohol that you drink, you know, at the end of the meal, also try to avoid that if you have reflux. All those things will reduce heartburn.
Is there anything you can do sort of in advance to try to prevent it? We obviously want to try the cranberry sauce. Is there something you can do?
You can take medicines, you know, but I would say, you know, even with the medicines, all you're doing is basically reducing the acid. If you can prevent it, if you have to have the cranberry sauce, yep, exactly. Take a medicine like, there's medicines like Zantac or what's called a proton pump inhibitor like Prilosec, and that could help. But the key is don't overeat. You know, we get these giant plates, right, during Thanksgiving, and we fill it up. So here's a tip. Have a smaller plate and don't fill it 10 times, just fill it once, and then eat maybe several times a day. Also, the desserts, avoid the low-fat desserts, and then caffeine and smoking are big triggers for reflux. Remember, if you have reflux more than 3 times a week, see your doctor to make sure it's something more serious.
You know, a lot of us like to take a nap afterwards. We have a full belly after Thanksgiving and we lay down. Does that affect acid reflux?
Absolutely. You know, all that food just basically comes up. So when you lie down, gravity doesn't work in your favor, so it comes up. So give yourself at least 3 hours between eating a large meal, whether it's Thanksgiving or dinner, and lying down. That's one of the biggest factors we tell patients. I even ask patients to not drink a lot of water before going to bed, because that makes a difference.
Really? Interesting.
Just the volume. And so I think that if you do those things, you can enjoy Thanksgiving without burning your house down and not having heartburn.
You don't have a lot of faith in us, do you?
I've been listening. I've been paying attention.
What do you have coming up at
Avoid
5
these
o'clock?
households. You know, at 5 o'clock, we talk about the terror threats and people are afraid of traveling. But what about health silent killers? I'll be talking about that at 5 o'clock.
All right, and we'll be watching for that. Dr. Nandi, thanks so much. Have a great Thanksgiving.
Happy
Action
Thanksgiving.
News at 5 starts right now.